Hello and welcome back to Project Move with me, Dr. Josh Weidman, myself, Matt Schmarkey. And today we're going to talk about probably the new most important topic that we've ever discussed, and that is breath work.
Yep.
It's paramount to our everyday health and performance. And we're going to kind of start with today, kind of talking about kind of like the physiology and basically the importance of everything. And then next time we'll kind of go more down and talk about how do we act upon
Sure. Yeah,
this.
it's funny because everyone's breathing and you think that you know how to breathe, but really our modern lifestyles have kind of almost corrupted the pattern to a certain extent. And so we're going to kind of get into the nitty-gritty of how to reset that and change things moving forward.
Yeah. Just kind of get a little context. How important breathing is. We take on average about 25,000 breaths a day.
Yep.
And you compound that over, a week, a month, a year, decades.
The math adds up.
The math adds up. So if we're just a little bit off, we can have huge detrimental effects in the short term and in the long term.
Yeah, and really what this comes down to is, if the pattern is off, it's almost this long-term chronic stress to the system, right? And so it kind of sets us up for all of these health issues that we're going to get into. But it's really at this fundamental level, it comes down to the breath.
Yes. Let's kind of maybe talk a little bit like the physiology. So what makes us as humans kind of unique to our breathing? Because as humans, we're like the only animals that actually run into issues as far as breathing dysfunctions, as far as like sleep apnea, even things as far as like even choking on foods.
It's interesting because the evolutionary progress that we've had to be able to have like complex speech patterns has shifted our like larynx like further down compared to if we look at other animals. So that sets us up for some of these problems because we're not able to breathe and speak at the same time. It's like one or the other. And so we have this issue where we're always going to prioritize air, and we're going to make these necessary like adaptations to prioritize getting air. And so if the system's kind of thrown off, we're going to prioritize maybe the suboptimal pattern just to make sure that we get air rather than using the optimal pattern that we should be using.
Yeah, so we're kind of uniquely set up to where we breathe differently, and we kind of run into the problem of it really just kind of comes down to just we end up switching from where we should be nasal breathing into mouth breathing.
Correct. Yeah, that the mouth breathing is that compensatory, if you will. We're designed to be nasal breathers, but because of these other potential, it's almost like we're kind of teetering on this stability, right? So if we get kind of kicked off the teeter-totter, the compensation is always going to be the mouth breathing. That's where we're going to default to.
Yeah. So we're set up for nasal breathing. We kind of end up, at least in the society that we're living in, switching to this more mouth breathing. And this is kind of where we run into a lot of issues. But this hasn't always been the case. It's really kind of more this modern time, you could say maybe post like really, I guess, industrial revolution, more agriculture, where we had a lot more access to foods in general.
Yeah, the processed foods or just foods in general that are softer, where previous we had to really chew our foods. It was more of a tough, fibrous, maybe even a little bit more, just dense type food, where now you buy your food at a grocery store and it's basically prepared for you, or soft, if you will. And so we just don't have to chew as much, and so we can actually see facial modifications or changes due to a lack of physical stress that we're not getting from the chewing. So, if we're chewing um, dense foods, it's putting a stress into the facial structures, and that actually shapes in a positive way. Whereas if we're eating these softer foods, we get these adaptations um, that really kind of set us up for this mouth breathing.
Yeah, so the foods that we used to eat, several thousand years ago, a little bit definitely tougher, required a lot more chewing. So we would actually have this a lot more mechanical stresses on our mouth, and the result was the muscular in our jaw would obviously even like hypertrophy grow stronger, and that would actually then shape and then pull the jaw out water. Whereas now with have a tendency to have a lot more softer foods that doesn't require as much chewing, we see this kind of narrowing of the jaw, and this is kind of where
Mm-hmm.
a lot of the issues kind of start.
Yeah, and we'll see. So like the arch of the palate becomes narrower. So we'll see teeth, crowding. Um, it actually changes the shape of the airway. It kind of flattens it out a bit. So just that wider facial structure tends to allow just more physical room. Whereas because we didn't get that mechanical stress at an early age, it sets us up for a narrower, more restricted system.
Yeah, and this is kind of like this epidemic that's really just kind of happened this past 100 years.
Yeah.
And I think it's just with the capabilities of our being able to mass produce foods, which then kind of comes along with the toughness of it. And I remember as a kid, like when I was a kid, I had to wear one of those bridges on the roof of my mouth that my parents would have to come in before bedtime and kind of turn the key just to kind of help widen my uh, jaw, so that because basically the roof of my mouth was just kind of pushed way too up,
Right.
or way up, definitely pushed up, and yeah, and it kind of makes sense. I mean, as a kid, my parents didn't really know any better, but definitely, gravitated towards delicious soft food,
Of
and
course.
yeah, it's no wonder that you kind of run into issues.
Well, and the interesting thing too, so the resting position of the tongue should basically be on the roof of the mouth, kind of right where it kind of meets the teeth, if you
Hmm.
will. And so the tongue is actually one of the strongest muscles of the body. So by creating that upward force, it actually helps to kind of widen out the palate. But by having this narrower structure, the jaw tends to kind of collapse downward. And so the tongue tends to rest much lower, or not against the roof of the mouth at all. And so we lose that, again, that physical stimulus. And so, again, that kind of leads to the palate being much more domed instead of a little bit wider, a little bit flatter to support the breathing pattern that we're actually trying to promote.
So our dietary has kind of shaped our mouth,
Yeah.
and let's say so it causes this narrowing of the jawline and then the narrowing of the nasal cavity.
Right.
What does that kind of force us to do? It kind of forces us to start switching to more mouth breathing.
Correct. Yeah.
A-
This orofacial collapse, if you will.
And then what issues kind of run in, especially, tongue can't sit in its optimal position,
Mm-hmm.
so tongue kind of falls down, which then kind of allows, if I'm not mistaken, more restricted. We have, for one, we have a narrowing of that nasal cavity, but now that that tongue is not sitting at the roof of the mouth, now we kind of have this uh, essentially flap that's kind of getting in the way of our mouth breathing now, and this kind of
Well, so the stimulus of just the air moving across like the back of the throat is again a mechanical stimulus that creates tone in those muscles, if you will. And so, or just that tissue. And so, if we're mouth breathing, we're not getting that same stimulus. And so, again, the tone, instead of being this nice open tube, it starts to oval and kind of flatten out, which again reduces the ability for just us to bring in air.
yeah. So it's kind of let's go back a little bit to nasal breathing. So let's kind of talk about the benefits to nasal breathing, because it kind of does several different things. It's going to warm our air.
Yeah.
It's also going to add moisture,
Correct.
so we're not going to dry out, and if I'm not mistaken, it also serves as a way to kind of clean the air as it kind of comes in.
Correct. Yeah, we have this natural like filtering.
Yeah. So if we switch to mouth breathing, we're essentially skipping that labyrinth that it has to pass through. Uh, we're going to run into a lot more issues where we're not able to put as much moisture into the air that we're breathing, so we're going to kind of dry out much quicker. And it also is going to lead to some more like dental issues, as far as, if I'm not mistaken, mouth breathing has been shown to lead to a lot more, I guess, dental decay.
Correct. The moisture, the mucosal, the saliva, like that actually protects against like acidic erosion. But as soon as the mouth dries out, that barrier, that protective barrier, is no longer there. And so, even without eating sugary foods, it sets up a natural environment for decay to be prominent rather than um, the natural, because like saliva is actually helping to remineralize the teeth. So if our mouth is dried out and we don't have that good saliva production, um, we are going to run into some decay issues for sure.
Yeah, whereas if we're, whereas if we're breathing through our nose, like I said, it has to go through that labyrinth where it gets warmed up, it adds moisture, it also kind of cleans the air, and one of the mechanisms in that is from our sinuses. So when we breathe through our nose, from our sinus cavities, we actually get a release of nitric oxide, and nitric oxide has a lot of factors when it comes to breathing, but one is it's definitely like antimicrobial, antibacterial, so it's going to help kind of clean the air as far as it goes in, but it's also going to help the delivery system of that oxygen.
Yeah, so nitric oxide is a vasodilator, so it helps to open up the blood vessels, and so this is a natural byproduct of nasal breathing. So as the air passes through kind of this labyrinth, like you said, that's kind of the activation pathway to create or to release nitric oxide. So we know that by nasal breathing, we can increase the delivery of nitric oxide, which I believe it's almost a 20% increase in vasodilation over mouth breathing. So we can get a performance enhancer right away, just because as soon as we open up the blood vessels, we're actually allowing more delivery of oxygen to the tissues. So we could be taking in the same volume of air, but we're actually getting a more efficient delivery to the tissues by having a wider vessel to deliver.
Yeah, makes sense. So now, if we're switching to more mouth breathing, and we're not getting this extra vasodilation, what other issues? Okay, let me backtrack a little bit. So our breathing kind of directly is a indicator of kind of our nervous system, in the sense that it kind of shows you what state of mind, or more specifically, kind of if we're in a more like a parasympathetic or sympathetic state.
Right.
And our breathing pattern directly represents the state that we're currently in. But which is kind of unique about like our breathing is even though it's in our autonomic system, we actually have control of it.
True.
And what that means is, now if we're in a state of stress, we can actually, by switching our breathing, kind of flip the script and kind of put us back into more of a more calm state. So usually whatever our outside environment kind of ends up affecting us and manifesting in our breath, and our breath is kind of the result of this external environment that we experience.
Yeah, breathing is more of an output. We don't tend to think of it that way, but breathing is an output of all the neural inputs. So yes, if we're stressed, we're going to see dysregulated breathing patterns. If we're calm and relaxed, we're going to see a completely different pattern. So yes, that makes perfect sense.
Yes, and that kind of actually ties into this nasal versus mouth breathing. So if we're as we mentioned before, it kind of goes with breathing. It kind of goes both ways. One, it's an output, but it can also then be an input and kind of put us into a certain state of our nervous system.
Because we have conscious control, that's kind of like the paradox. We're able to, um, if you're not thinking about it, your breath is going to happen, and your breath is going to be kind of dictated by your environment or your situation. But as soon as you kind of pause and think about it, you can create an altered state based on some of these techniques that we'll get into at some point.
But let's say we've kind of run into these issues, these other factors that kind of maybe cause us, like our diet for one, kind of cause us to switch to more mouth breathing. Now our mouth breathing is kind of going to dictate our nervous system state. So we almost can get into like this negative almost feedback loop where now, just because of the food that we eat and the shape of our jaw and sinus cavity or in our sinuses, we're now going to be kind of constantly in this more fight or flight system.
Yeah, so we're constantly in that sympathetic state. Again, think of it as like a smoldering low-grade inflammation. So if we did and we'll get into this here in a second, but if you look at like CRP, which is basically a blood marker for inflammation, we're going to see elevated CRP levels. But like heart rate's going to be different. Heart rate variability is going to be like altered. So we can get into that a little bit if you want.
Yeah. So yeah, let's kind of go into that. So let's kind of maybe talk about what we see in this fight or flight state of mind, this sympathetic nervous system.
Yeah. So our breath, we can think of it almost like as a pacemaker, if you will. So we've got the sun that sets our circadian rhythm, but the breath kind of sets our internal oscillations, if you will, of our blood pressure and heart rate and these internal functions, if you will. So the sympathetic dominance that we get with mouth breathing, we can alter that by switching back to that nasal breathing. So we can see the interesting thing with the heart rate variability. So that's a marker that if you've ever, I know you've worn like the Whoop, or if you've done like an Aura Ring, any of these kind of like, or even the Apple Watch, I think has like a function of it, and you'll see it as like recovery or like your rest score, if you will. And so the goal is higher heart rate variability means you have more adaptation to stressors, whereas low heart rate variability basically means that any little thing is going to kind of set you off, and you're not going to be able to respond favorably. You're kind of like locked into this stressful situation, if you will. Whereas someone cuts you off on the highway, whenever your heart rate variability is high, you're going to be able to kind of switch in and out of that with much more ease, if you will.
Yes. So we have this, like I said, we said that our environment can shape our breath, and then our breath can then feedback and kind of keep us in this more fight or flight. But if we're in a normal breathing pattern, like I said, we can kind of be more in this calm parasympathetic. And I know they've done actually kind of studies where like Stanford study, where they actually directly tried to see what results would happen if we kind of restrict people to mouth breathing. And that study was actually pretty fascinating, and it's going to kind of talk a little bit more about the effects physiologically that it kind of has on us.
Yeah, no, it's pretty fascinating. So the first 10 days, they basically plugged up their noses. And so this was only done with 2 people, but we can see direct kind of cause and effect.
Well, so talk about why it was only done with 2 people.
Yeah, so the original like idea, James Nestor from the book Breath, he's kind of like an investigative journalist. He went to Stanford. He has a couple of friends in the physiology department and in the medical school there. And he was like, I've got this idea. I want to look at the difference between nasal breathing versus mouth breathing. And whenever they went to the IRB, the review board, they basically shut him down, saying that it was unethical to do this test. And so he basically said, well, if you're not going to allow me to do this on subjects, I'm going to do it on myself. And so he got one of his friends to volunteer as well. So it was just two people, but they were able to basically see the effects of mouth only breathing, and then basically they were able to reverse the effects by going to nasal only breathing.
So yeah, let's go down the list. Kind of,
Yep.
what do we see as far as the side effects to 10 days of mouth breathing?
Yeah, so basically sleep apnea, like neither of them had sleep apnea beforehand, but they both wound up having sleep apnea like within 2 or 3 days of mouth breathing.
So yeah, in sleep apnea, we're having like at least, I think they had probably like upper like 20.
It was over 25 events where they basically stopped breathing during the night.
And they wake up.
Yes.
And as we know, kind of, so it directly affects sleep and the quality of our sleep. And
Correct.
if we're constantly waking up, that means we're not getting into those deeper stages of
The
sleep,
restorative type sleep.
where the good stuff happens.
Right.
We get that lymphatic clearing, so it's kind of like a recharging our brain, allows our brain to recover.
Sure.
Yeah, as well as allowing ourselves to optimize hormones and recover throughout the body psychosystemically as well.
Yep. So they also saw a 4,000% increase in snoring. So again, this kind of goes back to that like back of the throat collapse almost. And so that tissue just doesn't have the enough space or tone to be able to maintain the opening. So as it kind of collapses, again, that's contributing to these apnea events, or where they basically stop breathing.
Yeah, and then also saw increase in respiratory rate.
Correct. So, and that's something we can get into, but like the typical, like if we're talking optimal respiratory rate, it's really upwards, or sorry, not upwards. It's really around that 5.5 to 6 breaths per minute. Like that's like the perfect breathing. So it's super low. But if we look at a standard medical, like what's considered normal, it's 12 to 20 breaths per minute. So we saw, or the Stanford study showed, that they automatically went closer to that 20 breaths per minute as soon as they went to mouth breathing, and they completely shifted their ability to get oxygen, because we saw their O2 stat, like if they used a pulse oximeter, it dropped well below 90, and so 90 is kind of that threshold. Typically normal is in that 98 to 100, like that's where we should be, but they saw drops closer to that 85 to 90, so their saturation levels were super low.
Yeah, and kind of while we're on the topic of the respiratory rate, most people think we want to be able to take bigger, deeper breaths.
Yes.
But in actuality, we want to be able to take, shallower, maybe not shallower, but yeah, less volume as far as per breath we actually want to be able to take in. So that, and what that basically means is less work that we have to do, and we're just more efficient at delivering oxygen to the body.
Yeah, we'll definitely get into this more.
Yeah, I don't want to go
too. We're gonna put a pin in that, and we're gonna come back to that. So some more factors that we can get into. So again, we talked about CRP. So inflammatory markers increased. Their heart rate went up by like 20 beats per minute. They also, like their blood pressure went up as well. So
I mean, it went to up levels where they showed like
stage 2 hypertension.
Yes.
So we're talking, like if you went to your doctor with this number, they would basically want to put you on some sort of blood pressure medication. Yeah. And we will see here in a second, all of these metrics completely reversed with zero medication based on just switching the breathing pattern.
Yeah, just, and as we already kind of pointed out, I mean, nasal breathing alone vasodilation, open up the blood vessels,
Mm-hmm.
which is all going to contribute to that.
Yeah, they did a cognitive performance test, and so they did this test under normal conditions, and that kind of set the baseline. They did this test again under the mouth breathing conditions, and they saw like their reaction time was slower, their ability to perform in this cognitive function test also declined. um, they showed signs of brain fog and some of these other almost like cognitive impairments, if you will. So you know, we know that poor sleep impairs cognitive function. We know that sleep apnea impairs like, so all of these things, it's not just like it's one thing and then it's this downstream. It's like they're all feeding into each other, and so this one thing is making all of these other things worse.
Yes.
Yeah.
Yeah, and then so then yeah, let's kind of talk about. So then they did that for 10 days, and then after that 10 days, they went right back to nasal breathing.
So they basically they taped their mouth shut almost the rest of the time. Like they did the opposite. So unless they were eating, drinking, or conversing, if you will, they basically had their mouth taped shut. So if they were in the gym exercising, they had their mouth taped. If they were sleeping, they had their mouth taped. Throughout the day, they tried to keep it taped as much as possible. So they tried to shift as much as they could to nasal breathing, and so we basically saw all of those negative markers completely reverse. So their sleep apnea completely eliminated, their heart rate dropped back into their normal range, their blood pressure back to 120 over 80, every one of the CRP back to a normal level. You name it, it all improved. I mean, the HRV back into a good range. Their respiratory rate dropped back into a nice, healthier range. So all of these biomarkers that we saw decline, and you can really say these biomarkers are the signs of chronic disease. Like if you set this up for long periods of time, we're going to see systemic collapse of the entire system. Because what do we see with metabolic dysfunction, heart rate, all of these things, but they're deeply controlled through the way that we breathe.
Yeah, I think people just. I mean, it sounds a little frou-frou-y as far as like you got to kind of really dial in your breathing, but like, I mean, if you look at the science and then all the downstream effects and then how it kind of feeds back into each other, like it makes a huge difference. Because, I mean, affecting sleep alone, and as we know, sleep's just like the greatest reset. So now we're not entering deep sleep. If we're not optimizing our hormone levels, we're not getting testosterone growth hormone. So our recovery is going down.
Yeah, so that workout that you just did in the gym, and it could have been the greatest workout, you're basically not going to get the same benefits.
Yeah, if you spend 8 hours a day mouth breathing, you're canceling out no matter everything you did in the gym that day.
Pretty much, your memories aren't able to consolidate the same way. We know that if you learn a new task, whether it be in the gym, whether it be a skill, whether it be math problems, whatever, we know that if you don't get a good night's sleep after you learn the new thing, the consolidation doesn't occur to the same extent, and it's going to be much more difficult to recall or to incorporate that skill into your everyday life.
Yeah, and so yeah, and then like I said, if we're not getting good sleep, like I said, the cascade that leads to, I mean, we're opening ourselves up to more injuries, and it's just, I mean, could be, a lot of that could be prevented just from learning to breathe properly.
Yeah, one of the things I forgot to mention so after the whole like mouth breathing, they actually started to, both of the guys, they started to get basically a lung infection. They started to get a bit of like a cold, if you will. As soon as they went back to nasal breathing, the nitrous oxide, the NO, like that helped to eliminate the infection. They didn't take any antibiotics. They didn't take any, Mucinex or any of that. They were able to clear the infection. just by going back to nasal breathing. So, you know, this is kind of the cold and flu season. We're recording this, in December. So I think that it's something to kind of take into account if you start to feel a little run down. Just remembering to kind of go back to some nasal breathing could help to offset some of the sickness that we might have.
Yeah. And kind of when we've kind of put in a pin in it from before, and we kind of talked about how we're not getting as good of delivery of like kind of oxygen kind of to our system by when we switch to kind of this mouth breathing.
Correct.
And I think this is kind of where most people think everybody kind of thinks it's it's like a lack of oxygen, but really the kind of like the master control switch to everything is it's not actually how much oxygen we have in our system. It actually is carbon dioxide.
Yes, so carbon dioxide is basically the master regulator, if you will. So think of hemoglobin as like a delivery truck. And think of CO2 as like the key to the back of the truck, and think of oxygen as the cargo. And so you can have a truckload full of oxygen, but if you don't have the key to get into the truck, you're never going to be able to deliver the oxygen to the tissues that you need.
Yeah.
So the key to getting the oxygen to offload into the tissues is having the CO2 as like the switch, if you will.
Yeah, because carbon dioxide actually, when it's in the system, as we breathe in and we're going through some metabolic expenditure, we release carbon dioxide, and it's that buildup of carbon dioxide in the blood, which then gets converted into carboxylic acid, and it's that acidity in our blood that causes the release of that oxygen from the hemoglobin.
Yeah, so there's a very tight regulation on pH. So we don't want it to be too acidic. We don't want it to necessarily be too alkaline. But whenever we overbreathe, especially through our mouth, we actually make the system more alkaline, but we need that slightly acidic environment. And that's, again, the mechanism for that gas exchange, if you will.
Yeah, so on that, so if we're mouth breathing, we're typically taking shallower breaths, we end up offloading more carbon dioxide, so we actually don't get this rise or decrease in pH, which then causes the release of oxygen from the hemoglobin and then delivery to the tissues which are needing it. So we kind of actually end up having this kind of this like negative feedback loop where, because we're trying to take these bigger, deeper breaths, we're actually forcing kind of the opposite response, and we're kind of now putting ourselves back more into that systemic fight or flight state.
Well, the interesting thing too is, so like if you ask someone, they're going to say, I don't feel like I'm getting enough air, or I feel, and so it's like they're trying to get more air in, but it's not an air problem, it's a delivery problem. And so by constantly blowing off the CO2, you're not allowing the system to actually create the exchange. And so it's not the fact that you're not taking in enough air. It's actually that the CO2 isn't there to offload the oxygen to the tissues. So it feels like you need more air. And so that's where kind of like the paradox of like, we actually need to breathe less to allow the oxygen to get to where it needs to be.
I mean, it makes sense. Yeah.
And
So,
if you like an asthma patient, they're going to say the same thing. And it's, again, they don't have the same efficiency in the ability to offload, if you will.
Yeah. So that kind of makes you think, like, whenever you're going through a workout, let's say you're a chronic mouth breather.
Yep.
You're not going to be as great as far as being able to deliver those oxygen to the tissue. So a lot of times, like, especially in the CrossFit higher intensity space, I know when you're going through high intensity workouts, you kind of like hit this wall where you kind of feel this, like your legs go heavy, or this, like you feel failure, especially like on the fan bike. I'll use that if that's a good example.
Mm-hmm.
usually it's like my legs will always end up kind of giving out before I feel like my lungs do.
Yeah, it's interesting.
And it's not actually, it might not actually be because you've reached like complete failure in the tissue of your leg muscles. It could actually just be, and knowing what I scored on my resting pause test, which we'll talk about here in a second,
Yeah.
it makes you kind of think that maybe it's actually the delivery system of that oxygen that's causing the limitations.
Right. So that's called the metabolism reflex. And so basically, when the muscles of respiration, so diaphragm is primary, and then your intercostals and some of the accessory muscles of the neck, when those start to fatigue and the brain senses I'm not getting, as much air as I think I should, it basically um, takes all the blood from the legs in this case, or the arms, and starts like shunting it to the diaphragm.
Blood stealing.
Blood stealing. So the reason why the legs give out is because the body is basically taking the blood that should be to the legs and trying to give it to the diaphragm, because the diaphragm doesn't have, because we don't think of the diaphragm as a muscle that we can train, but it's absolutely a trainable muscle. So that's one thing. And so we also don't have this CO2 tolerance to be able to handle higher levels. And so it basically throws us into this fight or flight. And so the body, the brain basically says, we don't want the legs to be the primary. We want the respiratory. And so it kind of steals the blood and puts
Yes, especially as we kind of enter into that like aerobic respiration phase where oxygen is becoming so critical.
Yeah, and if you've ever done like a VO2 test, you'll see there's a special and like flexion point where we start to see all this change, and that's kind of one of those points that we can kind of map out, if you will.
Yeah. So carbon dioxide is kind of really the regulator as far as
Yes.
our nasal versus kind of mouth breathing.
Mm-hmm.
We kind of talked a little bit about how with nasal breathing, we kind of musculature that we typically use, and as we switch to more mouth breathing and these more deeper breaths to kind of, strategically offload CO2 when we get into these higher intensity things,
Mm-hmm.
We definitely see a shift as far as like the muscles that we use. Let's maybe, how do we kind of know where we're at as far as being able to kind of measure where we stand currently, whether, since we now know that carbon dioxide is like that master control switch, how can we score ourselves and kind of rate ourselves as far as our CO2 tolerance?
Yeah, so it's a very easy test. It's called the controlled pause test. And so typically this is done first thing in the morning. That'll kind of test your baseline for the day. You can use it at different times, but typically done first thing in the morning. So basically what you're going to do, you're going to take a normal breath in, a normal exhale, and as soon as you're kind of done with the exhale, you'll kind of plug your nose and then start a timer kind of simultaneously. And so the goal is we want to try to figure out the time it takes for that first like urge to want to breathe. We're not looking for max hold time. We're just looking for when does the body kind of say, I want to breathe. And so whatever that number is, that's kind of our baseline, if you will. And so 20 seconds is really kind of the threshold for quote unquote health. If you're below that, you're going to be suffering from a lot of those problems that we talked about earlier from the Stanford study. Optimal physical performance is upwards of 40 seconds of CO2 tolerance.
When we get above that 40 seconds, we're kind of seeing those elite athletes.
Absolutely. So, whether you're a cyclist, elite CrossFitter, like any of those, we would surely see upwards, maybe even a minute or more,
Yeah, and so we definitely don't want to, like I said, this is measuring CO2 tolerance. So with this, we kind of need to be pretty conservative in our essentially our breath hold here, or our pause, because, like I said, if we have a low CO2 tolerance, we kind of subconsciously kind of start to switch and change our style of breathing. We'll kind of switch to more mouth breathing. So it's really important to not try to, try to have this idea of like, oh, I want to score above 20 seconds. You really want to be honest with yourself, just because
you're not going to improve if you
and it's, yeah, like I said, it's measuring your CO2 tolerance, because you're not going to, when you're in everyday life, you're not going to know when you've reached your tolerance. You're just going to end up, your breathing patterns are going to switch as a result of that. So establishing a very good, unbiased measurement to start is only going to allow us to kind of improve from there.
Correct. And so we can then use this, and we can start to do it at different times of the day, and you can see how does it change over time. You can do this. So just imagine you start doing the mouth taping at night, and you see, oh, my CO2 tolerance is actually starting to improve just by keeping your mouth shut for 8 hours, right? But if all of a sudden you start to see that number dip again, maybe the seal broke, or maybe the tape came off, or something, and so you can start to see that you've shifted the pattern back to more mouth breathing. Or whether you're in a high stakes situation, a board meeting, or something, that those stressful situations are going to tend to kick you back into that mouth breathing. So it's not necessarily going to be a number that stays consistent. It's going to fluctuate with different stressors, but knowing what your baseline is and knowing how to change it, which is what we're going to get into, will be kind of what we kind of start to look at next.
Yeah. So homework. Next time we're going to talk about practical applications as far as how to kind of improve upon this, and kind of also talk about different styles of breathing. And because there's Wim Hof, there's box breathing.
Yeah, I think the issue is people they find a style, and then they think that's the end all be all. But really what we're going to try to kind of lay out is that the method should serve the goal, and we can use all of these different techniques for different applications, as long as we know when to apply them.
Yeah, it's the right tool for the right job. We're not going to use a hammer to try and screw something in.
Yeah, we're gonna be more principle based rather than protocol based.
Because there are some times where we want to go into more of this fight or flight and really try to actually build up oxygen concentrations.
Yeah, I mean, if we were, say, a free diver, we're going to use that almost hyperventilation to kind of put ourselves in a state, but that's not something that we need to be doing on a daily basis. And we'll kind of get into the daily practices, the high performance kind of tweaks, and then kind of what we need to do to regulate ourselves in stressful situations.
So yeah, homework. Let's try this controlled pause test. So
get your baseline.
First, when you first wake up, try doing it when you first wake up.
Mm-hmm.
Normal inhale, take a few breaths first. Normal exhale. As soon as you exhale, plug the nose, start the clock. And then maybe then try it maybe 10 minutes later. Just try to do some maybe more calmer breathing, or just kind of sit quietly and actually try to breathe through your nose. Mm-hmm. And then actually maybe retest, because we may find that immediately after waking up, maybe we don't know if we're a mouth or a nose breather. We actually may see a better score having given just a little bit of focused on some maybe some controlled breath work before.
Absolutely. Yeah, that makes sense.
So, kind of recap. There's a lot of factors kind of contribute to how we breathe. We talked to start about our diet's going to be, play a big shape, especially early on in our development, in our childhood. Eating these softer, squishier foods that don't require as much chewing is going to actually shape our mouth, causing a little bit more narrow the musculature, narrow the jaw, which is then going to kind of compress that nasal openings.
And I would say, even though the shape as an adult is more or less set, it still doesn't mean that the resting position of the tongue, that can still help improve the airway. Chewing, it's still going to help stimulate the tissues. We know that load is the language of force is the language of self. So we still can see benefits from
Oh yes.
adapting to some of these
I mean,
things.
you see these devices, like these chewing devices that people can buy to actually help strengthen their jaw to essentially allow for better airflow.
Correct, correct. So even though the structure is somewhat kind of set, it still doesn't mean that we can't still kind of play with some of these factors. So don't think that you're just kind of set in stone with your structure, if you will.
Yeah, and then just the importance of nasal versus mouth breathing,
Hmm.
how it's gonna help us kind of put us more into this calm state, like rest and digest,
Yep.
versus into this fight or flight state.
Yeah, I think that if you asked anyone, everyone's going to say, "Oh, I feel stressed," and it's like, "How are you breathing?" Like it can come right back to as simple as that. And so if you can, because I think we'll talk about this next time as well. Like the awareness piece is huge because we first need to be aware before we create any kind of change. We don't want to just jump into like, oh, I need this protocol. So just being aware of, oh, I hold my breath whenever I read an email that I get a little fired up, or being aware that whenever I'm preparing for my meeting that I tense up and hold my breath. So just being aware of how you kind of tend to be, and then knowing that you can use the breath to kind of calm yourself down or kind of put yourself in a better state, I think is important.
Yeah, it's the great thing about breath is like our environment kind of controls our breath, but like I said, it's one of that those. It's the only autonomic system that we can actually then control ourselves and kind of then change our mindset.
Yeah, which is what makes it so powerful.
Yeah. So let's go ahead and give this controlled pause test and stick with us or join us next time, and we'll kind of go through what the maybe talk a little bit more about those results and how we can improve upon that from there. Anything else?
No, I think that covers it. I think that's a good place to kind of wrap it up.
All right. We'll catch you next time.